Welcome to another episode or in our series of what we wish we had known before we became sex therapists. I'm Sari Cooper. I'm co-founder of the Erotic Intimacy Academy, and I'm here with my co-founder, Kelly Ghweinem. And our topic today is, because it's Pride Month, but because it's an important topic any month, is the topic around how we talk about gender and identity and fantasies and behaviors now versus how we did it in the past before we became sex therapists, right?
Mm-hmm. Yeah. So when I was a general therapist, and even in the beginning of sex therapy, before I really got into like queer-affirming therapy, which I'll talk about a little bit more, and like how I've changed actually using that term, but I'm going to use that now to talk about it, it was
Mm-hmm.
just pretty much based around like orientation and gender identity and on the intake form. And sometimes during therapy, like it would come up, but it wouldn't be a very central part of the therapy, and we wouldn't really go into it more. Where now, as a sex therapist, it is something that is not. It's not that therapy is completely centered around that, but there is more attention given to it. And what I mean by that is in my like intake forms, it does ask orientation, gender. It also asks like preferred name, and so in all of the documents in the portal, it uses the person's preferred name. But like on it, if they use insurance or if they need out of network billing or something, it has whatever name matches their insurance form, right? So that they get reimbursed for it. But in the like when we're doing sex therapy, there's also let's say, for example, someone is coming for, they're questioning their gender. They're trying to figure out what is going on. Maybe they're feeling like, I think I might be trans, or I think I might be non-binary, but I'm not sure. I want to talk to someone about it. I'm like having these feelings. I ask a lot of questions and we explore that identity. And the way that I ask those questions can sometimes feel maybe not to the client, but if someone is coming from a perspective of gender affirming therapy, it could feel like I'm not being affirming because we're being exploratory, because me and this person, the client, are exploring these different ideas about gender or about their sexual orientation. And so when I said in the beginning about queer affirming therapy, I don't think that's the right label that I want to use for my therapy approach anymore. I want to use more like expansive therapy or
Yeah.
exploratory therapy, because it's not completely affirming, because I'm working with the person for them to explore their own identity and for them to come to the conclusion for themselves on what they want out of their lives or how they identify.
I like that. I like that expansive uh,
Mm-hmm.
therapy. I think what one of the things that I notice very specifically, and you can, is that if someone came in for treatment who presented as heterosexual, I
Mm-hmm.
would not necessarily, I wouldn't usually ask them about any sort of same gender fantasies unless there was something in the stories that they were telling me that kind of pinged me to think, oh, well, maybe there's more here. Um, and whereas I might not have asked someone who presented as lesbian or gay or queer about whether they had any um, what researchers call cross gender, or we call it other gender, but experiences, because we know that a lot of people who come out as queer, right, have had, heterosexual relationships in the past. But just that imbalance of asking one set of clients that question, but not the other,
Mm-hmm.
is a difference in what I do now, which is when I do a sexual history and we teach therapists how to do sexual histories. We always ask them, have you had experiences with same gender, with transsexual people, whatever, you know, transgender people? Like, what are the expansiveness of your sexual experiences and or sexual fantasies, right? And just in the nature of asking the questions of someone, the client is getting the message like, oh, like this is a place I can talk about all my fantasies, all my experiences. I'm not going to
Mhm.
be pegged or labeled in one way or another. And so I think of that as more fluid. Yeah, because as I've become, since I've become a sex therapist like 15 years ago, right? I've been reading the research and the books about sexual fluidity, and the research has really come a long way in the last 15, 20 years to show that actually men and women have a lot of fluidity in
Mhm.
who they're attracted to. And I think we're seeing more of that in identities as well. So by asking the questions of everybody, right?
Mhm.
You're being less heteronormative, and
Mhm.
you're actually following science of, this is what is out there according to the research. And thirdly, you're giving permission to the clients of being able to own their own fluidity, right?
Yeah. And something that I've noticed too by asking everybody is that when you are more detailed in the questions that you ask, and you're very specific, they will answer them. Where if you just say, let's go over a sexual history, tell me about your sexual partners, sometimes people leave things out, not, and for many different reasons.
Mhm.
But when then you go in and ask, okay, have you ever had these types of experiences, or has this happened? They will expand on that, and it provides great clinical information, because also that could be used. Let's say someone is heterosexual, right, but they have same-sex experiences, or
Mhm.
it is a same-sex fantasy, and they want to somehow bring that to their relationship. And I think we touched on this on another what we wish we had known, but us asking that question also gives them permission to, like, to be more comfortable with it, to bring it to their relationship if that's something that they want to do, or for their own internal sexual experience. It's like, oh, okay, this is, I don't need to necessarily be like ashamed or be stigmatized for this, because a lot of people do feel shame or stigma around, this is something separate, but around having an LGBTQAI plus identity, right? Especially in mental health settings, because we do have a history of um, harming people with LGBTQ identities through the DSM.
Pathologizing.
Yes, and so it's been something that is, it's very important that as therapists we do take this expansive approach and allow for a place for someone to feel safe and comfortable talking about their identity and exploring their identity.
And I would jump on that to say, because what I'm hearing you say also is that people have all sorts of experiences
Mm-hmm.
that they don't have labels for, and they don't want labels. They don't
Mm-hmm.
want to name it as an identity. They don't want to name it as an orientation for a variety of reasons.
Mm-hmm.
And it's not our role to provide them with those names or labels. It's just being able to sit and listen to it and being helpful and supportive of whatever they're interested in, and seeing if they want to do anything with it or not, right?
Yeah. Something that just pinged for me is some like discourse I've seen around this from, other therapists online is, or other, maybe not just therapists, but other people online too, is if you're not giving a label for it, then you're not being affirming in some way. And the way that I feel
Mhm.
about that is, I don't agree with that. I don't think that that's true. I think that people should be able to identify if they want to give themselves a label or not. Like, that's up to them. It's not me. Like, I'm not the expert in the room here. The person that's coming is the expert in their own life and what they want to say about themselves, how they want to present in the world, how they want to identify themselves.
And in the end, we're helping people feel more healthy and somatically present,
Mm-hmm.
and able to ask and pursue pleasure for what they want to do, right? That's really what we're here for. And if part of that is saying, I think I do want to own this as
Mm-hmm.
an identity. Okay, they were following their lead. As you
Mm-hmm.
said, they're the expert in the room. I think the other thing I think that I've gained as a sex therapist, because my background is both systemic family systems as well as psychoanalytic, psychodynamic,
Mm-hmm.
I was aware of erotic transference as an earlier career therapist, um, which is that I was aware that clients might have erotic feelings about me,
Mm-hmm.
and I could be able to ask them about it. But I think if I felt like if I was hearing something again in their narrative, um, but I think I become more comfortable with people out and out clients out and out asking me maybe questions beyond the usual ones that therapists get, which is, are you married, or do you have a partner, or do you have children? Um, those are kind of the most common questions that clients have about us. Uh,
Mm-hmm.
but now that I think because we're asking such very intimate questions about their sexual histories and their current lives, sometimes people want to know whether we've had certain experiences. Yeah.
Mm-hmm.
So you
Yeah.
can talk more about that as well. And I think I don't get the pit in the stomach anymore, than I might have been a little bit more nervous when I was
Mm-hmm.
younger and earlier career.
Yeah, I think so. The types of questions have changed with not only becoming a sex therapist, but also with the populations of people that I've worked with. And so I do work with a lot of people in the kink community. And something when I first started working as a sex therapist, people would ask like, "Oh, are you in the lifestyle, or do you participate in kink?" Or even maybe they would like describe their kink and say something like, "Oh, I don't know if you're into this too," and that would, put like a pit in my stomach, and I wouldn't know how to respond because there was this, internal thing going on inside of me of like, okay, self disclosure. How much do I want to? Add here, why would I add it, like what is the benefit to them, but then how much do I want to keep private? And so in my earlier career, like as a sex therapist and as a general therapist, that was something that came up kind of often, and I would have to deal with it. Now that I've had more experience with it, I know that it's not necessarily the like content of what they're asking that I'm uncomfortable with, but like the moment of how to navigate this and um, like what am I going to do here? And still, as a therapist, like many years in, that is something that sometimes I do get a pit in my stomach, and I'm just like, oh, I don't know. Sometimes I don't, and it could be the exact same question, but again, like talking about transference, I think it also depends on like the person that's asking and what's coming up for me for countertransference there, right? And what shows up in my body when somebody asks me that.
Yeah.
And it's
So,
so, yeah, go
yeah.
ahead.
I mean, I would say the same is true, with relationship structures, right? So
Mhm.
we ask people about if they've had ethical non-monogamous relationships, whether they've had consensual non-monogamous, or they come in with saying, I'm CNM, I'm in a consensual non-monogamous relationship, we need help navigating this, or
Mhm.
we're polyamorous, right? Um, and then they may want to know, right, do you know about these things? Like, I
Mhm.
mean, clearly we both have done work, and I've written a lot of blogs, so I think people know that I work with that community. But they may want to know, how much do you know, and how do
Mhm.
you know, and do you practice this kind of thing? And I think that, like in any other sort of personal question, and certainly about my private life, I'll just say, it's understandable that you have those questions, but I don't share what I do in my private life with other
Mhm.
people, because it's private, and we're really focusing on what you're looking to do here and what your goals are.
Yeah. And so I take a little bit of a different approach, and that kind of goes to the queer affirming therapy, right? Like I do put out there that I'm queer, but also during intake calls, sometimes consultation calls, people will ask, like, if it's for CNM or ENM, like what experience do you have? Have you ever been in a relationship like this? And I'll answer because they are looking for a therapist that does have that experience. Or maybe they've been to a therapist before that said they were affirming in this way, but then didn't really have the knowledge. And not saying that you have to be experienced in your own personal experience to have the knowledge to be able to work, but I know that people do feel more comfortable with that. So those types of things I am more upfront and comfortable about, but other types of questions that that does like ping things for me or activate things for me, and I'm just like, oh, what's showing up for me in this
Yeah.
session and why? And being able to notice that countertransference in the session, or being able to notice that, is important work as a therapist, right? Because we have to be aware of our own selves and what we're bringing to the room. Not only like knowledge, right, but our emotions, and then how are we using that consciously or unconsciously when working with our clients.
And I also think, like, we consult, we supervise
Mhm.
therapists, right, in our Erotic Intimacy Academy, see its certification. And I think one of the benefits to having both of us, right, in the room is that we have so many years of experience to know that we don't have to respond right away to somebody's
Mhm.
question. Like, we can really sit with it to understand what the motivation is of why someone's asking.
Mhm.
Not to necessarily psychoanalyze it, but like, wonder where that's coming from. And to your point about, when people come and they are curious and they do ask those questions, even in an intake call, because they had a negative experience. It may have been like just a word that the therapist used, or the tone. I've had clients come in and say, this person asked me this question. It was so ill-informed and
Mhm.
judgmental. I mean, it was just, ugh, I didn't even want to be in the room anymore. Um, that's more of like the issue. And so asking someone why they want to know, did they have a bad experience in the past around feeling safe and relaxed, whatever they discussed,
Mhm.
it's really important information to get to know.
Yeah.
Yeah,
Well, that was a good discussion.
I know. So we are working on this month
Mhm.
in our Erotic Intimacy Academy,
It's
right?
called Unlabeled Desires, a deep dive into gender and orientation. So we're really talking about um, different types of sexual orientation, relationship orientations, as well as gender identity, and how that can show up in sessions, and how therapists and coaches can work with people.
Yeah. Yeah. Well, we hope you'll join us if you want to take a dip in the water to see
Mhm.
what our See It certification is like. We have our live virtual case consultations at the end of the month, and you have an hour and a half webinar and readings to prepare, and you'll hear a case being presented, or you can bring one of your own. And so check us out at www.eroticacademy.net. Um, this, I guess the June offer is on the homepage.
Yep.
Yeah. Yeah. Thank
Thank you.
you.